patient was in uh, metabolic acidosis compensated or respiratory alkalosis compensated. This is where then the clinical picture of the individual comes in. That's what's going to help you with the diagnosis. Do you understand?
No, I missed it. I had to pee.
So again, 7.45 normal.
Normal.
So, but then this is low, that's abnormal. This is low, that's abnormal.
Low,
right?
low.
So
Okay.
if this is low, I can say that it depends. Maybe the patient, you will look at the problem of the individual. So,
So
maybe this
both
is
of
a
them are low.
diabetic patient.
How are they compensating?
Huh?
Because the
I said
pH
it's
is
the
normal.
Even each other out.
Look at the pH is normal.
Oh, okay.
So always look at the pH
Uh-huh.
and the numbers are abnormal. I know that it's compensated already.
So both are compensating each other.
Co- Yes. One of them will be the problem. So it's very important to look in your test on ABG. I will have, let's say, a patient had diarrhea. That's what will help you in diagnosing whether it's a respiratory or metabolic.
Well, how do you know
problem.
which one is which if they're both compensating each other?
That's why I said you have to look at the clinical. When you get an ABG,
Uh-huh.
you're always looking at the history of the patient. Very important. Let's say I'm going to say this patient is a diabetic patient. Diabetic. So what do you think? Would it be metabolic acidosis? Would your diagnosis be metabolic acidosis compensated or respiratory alkalosis compensated?
Metabolic.
I think it's metabolic.
Yes,
Yeah.
because diabetic. So you should use the clinical case to help you with the diagnosis.
So if someone is
Let's
got
say someone
some
has
kind of
asthma.
respiratory, yeah,
That's
then
gonna
it
be
would be
that's a
respiratory acidosis.
Yes. If both values are abnormal, you don't forget to add the word compensated. See, both are
Okay.
abnormal. I'm going to write the word compensated already. Right? Okay, let's look at the next one. What's this one? This is high, so I'm going to write alkalosis. Right? This is normal. So this is not compensating, right? See, that's why it's still high. Alkalosis, and this is high. So,
Metabolic.
metabolic alkalosis.
I can't think that fast. No. You guys are going way
One
too
more
fast.
time. The pH is high. I'm going to write, see, high, alkalosis.
Okay.
Look, and then the
Osis.
carbon dioxide is still normal. No wonder this is still high, right? But the bicarb is high. Look at our values. This is the normal. So it's high. So this patient's problem is metabolic alkalosis. You know, this is very common maybe when you take too much of those vegetables, you can go into metabolic alkalosis. Or you have, some people do gastric suction, right? When you, or vomiting, you're vomiting too much of the acid, then you go into metabolic alkalosis.
We had a nurse that was into this high pH water,
Oh,
the alkaline water, and he was drinking massive amounts of it, wound up in the hospital with alkalosis.
See, and the nurse was normal. It's not just a problem with sick people.
So the
we can go into this acidosis.
The HCO3 is metabolic, the
PaCO2
is respiratory.
So what's the correct diagnosis? I'm going to write metabolic alkalosis uncompensated.
Uncompensated?
Yes, don't forget the word
Uncompensated?
Yes,
Because nothing's-
because it's not corrected yet. As long as the pH is still abnormal, you're going to write
Okay,
uncompensated.
because the pH is not normal. Is
About
not
the vegetables that we were talking about.
normal.
Like, if we're eating,
Okay.
kale too much, or
Yeah, look at the pH scale. Watermelon is acidic, but there's a lot of vegetables and fruits there that's very alkaline. So if you eat too much of that, you go into alkalosis.
if people eat kale.
How can water be more acidic if it's mostly water?
Yeah.
Doesn't make sense. What in water
Water has a
makes it
pH.
acidic?
And no one, huh?
I said, Watermelon. How
I
can it
don't
be
know.
more acidic if it's mostly water?
No, it said in the pH scale. Look it up in your pH scale.
Okay.
Acidic and even too much glucose
So if your
also.
pH balance is normal, then it would be metabolic alkalosis compensated.
Yes.
Okay.
We're gonna look at this one.
By
You're going to get
the
used to it.
respiratory system.
You're gonna
right?
get used-
Respiratory
would
acidosis
be-
uncompensated.
What did you say?
Respi-
Acidosis?
respiratory
Respiratory uncompensated.
compensated.
Did you get this?
Yeah.
No.
Look.
I can't look at it and just say it. I have to like break it
Look.
down each piece.
7.3. What is this?
Acidosis.
7.3 is normal.
It's acidosis.
No, acidosis.
Wait a second.
It was 7.35 to 7.45.
Oh, okay. Is so it's
This is, so in other words, this is 7.30. So that's acid. Look at the
Okay.
PCO2 is very high.
Huge.
And then this one is still not compensating. So I'm gonna write uncompensated.
That's a COPD or
COPD, that's
Emphysema.
asthma, emphysema.
HCl.
So don't forget to look at the clinical picture.
So that's
And
normal, that's high, so it's respiratory acidosis compensated.
uncompensated.
Uncompensated
Because-
because of the pH.
That's right.
Look at this one, it's still normal. It's still not working.
Oh, normal.
correctly.
Cool.
Respiratory
This isn't as hard as I thought it was. My
Yeah.
mom made it sound so damn difficult.
acidosis uncompensated.
I like this. Just lay down. It's like, okay.
She
Okay,
made it
so
sound
my
so bloody
question-
hard.
What if it's, the pH is normal, wait, okay, what if the pH is not normal, but the HCO3 is not normal, or normal? Is the HCO3 normal? Oh, it is normal, okay. So what if it's not normal? It's still uncompensated? I'm kinda confused.
What,
On the
so-
compensation versus
Well,
uncompensation
if this one,
is not normal,
so what do you mean? If it's going up?
Yeah.
Then you're gonna write, okay, very good question. Let's say this one is going up. Now the PCO2, let's say instead, the
It's like
bicarb
30
instead
or
of
something.
24, let's say it's 30. But
Okay.
then the PCO2 is still low. I'm going to write respiratory acidosis
Acidosis.
compensating.
Teen. It's in the
Compensating.
process.
Okay.
Why is it compensating?
Because it's in the
working,
process of fixing.
It's slowly working.
72.
Except it's not there yet to correct it. It's compensating.
Compensating meaning it's changing the pH.
It's trying
Level?
to fix the problem.
It's the action
Okay.
verb.
You're the one who asked me.
I know, but that just makes me more confused.
Again, compensated, uncompensated, compensating. Those are the
Compensating.
only things, words that you need to add. Again, look at this one. The patient is in acidosis. I know respiratory. Don't forget, I'm always going to include the clinical scenario. Let's say an asthma patient came in. These are the ABG. This is the ABG result. Can you give the interpretation?
Change it from compensating to it's either fixed, not fixed, or in the
Yes.
process of being
Okay.
fixed.
So we're gonna say
Does
first
that make
we
more
write
sense?
we write asthma patient. This is the ABG. What's your interpretation? And if we get this one, you're going to write respiratory acidosis compensating.
Okay.
In the process of being
Okay?
fixed.
How about if this is what we get? Respiratory acidosis uncompensated.
Uncompensated.
You see that, everybody?
Yes.
Because the bicarb is still normal, this is uncompensated. Maybe after a few hours you get the ABG again of the patient, you're going to see the same, but then the bicarb is going up, 28 or 30. Now you say compensating. Yes?
So if it's going up, that means it's always good in the works. But what if it goes down? Is it still in the
Now
works?
we're going to look at it.
Oh,
Just a minute. Very good. You got this part. Did you all get this part? No.
Mm-hmm.
Everybody?
What was that one?
What is this one? This is
Compensating.
compensating. Again, we start with this one. What's this one? We start with an
Uncompensated.
asthma patient. ABG showed this. What's our diagnosis?
Respiratory
acidosis
uncompensated.
uncompensated. Then 2 hours later, you get the pH, the ABG, now it went up. I'm gonna write 29. So, respiratory acidosis
Acidosis
compensating.
compensating.
It's compensating now. Yes.
Okay.
And then how about next 2 hours later, it's 30. Now this is 7.37. So this is, let's say, going down. So it's respiratory acidosis. No, yeah,
No.
you can write respiratory acidosis compensated. It's now compensated.
Because the pH is now
The
normal.
respiratory acidosis was now corrected. Now the pH became normal. You understand?
Yes.
Your question. How about both of them, right? You say both of them. So this is very high. This is your patient. You say asthma patient. Very high, and then your bicarb, let's say, is 19. What's your diagnosis? I have an asthma patient. This is the ABG. What's your diagnosis?
It's respiratory acidosis.
And metabolic acidosis.
Both, yeah.
You're gonna write combined. You've seen that, right? Combined respiratory and metabolic acid. This is
Acidosis.
dangerous. How can you correct when both
You're
of
in
them?
deep crap.
Yes. These patients now need intravenous help from you. This is the one where you see, can you inject bicarb to this patient?
This is a COPD or with diabetes.
Maybe. Yes. You understanding? Very good. Very
So
good.
what is this respiratory acidosis?
I know
Respiratory
this is
and-
respiratory and metabolic. So I'm going to write combined respiratory and metabolic acidosis.
Combined.
If it's combined, what does this mean? You have to help. You have to give intravenous. You know, doctors always say, can you give intravenous injection of bicarb, right?
I see it all
One
the time.
bolus injection.
We have a lot of people who get an IV
Very good. Very good.
metabolic acidosis. Okay.
Next.
Too low, and
Let's look at this one.
too
Normal.
high.
Right? Down. This is down, right?
Yeah.
Yep.
And this is also down.
So
So
it's combined respiratory.
no, 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 no.
Because that's normal.
It's compensated.
7.5
But it's still,
Compensated.
but it's still
normal.
combined.
No, it's compensated. Let's say
But the
because it's
pH
already
is normal.
corrected.
Down.
I was gonna
So-
say,
But it's
isn't
still
the
gonna be
pH level
combined.
normal?
Yes, but it's compensated.
PHCO2.
So all you write is compensated. You don't bother to write acidosis or
You're
alkalosis.
gonna write either metabolic acidosis compensated, or
You're gonna write-
respiratory alkalosis compensated.
Alkalosis?
It depends on the case.
Why
Yeah.
alkalosis? The pH level is normal, so how is it alkalosis?
No, it depends. That's why I said respiratory alkalosis compensated. So by
Okay.
this pH, it's telling me that it's been corrected. So when it's corrected, very good. We're gonna write compensated, okay? But the PaCO2 was low.
The
So maybe the
PaCO2
patient was in respiratory alkalosis and
Oh, I
this one
forgot they're backwards.
compensated. Okay?
No. Because how do you know
That's why
how do
I
you know
s-
the pH level was
Because that's the pH.
too
It's-
high or too low?
The pH is it's not telling me that it's telling me this is the value, right? That came out.
Yeah.
I see what you mean. How do you know if it's alkalosis?
Or
That's why I
acidosis.
said you have to read at the clinical. They'll say this
Okay.
is a patient who had diarrhea. This is the ABG interpret.
Okay.
I'm going to make sure that there's always. So the next.
So it would be a metabolic,
What-
if the patient had diarrhea, it would
Yeah.
be metabolic, but how do you know it's acidosis versus alkalosis?
You
Because of
look
what?
at the value. So what is this one? If the patient had diarrhea, what are you going to write? Is this acidosis or alkalosis?
Acidosis.
Acidosis.
Very good.
They're
Metabolic
backwards from each
acidosis
other.
Yes, compensate.
That's what threw
Very
me, is
good.
they're backwards from each other.
Very good.
So if your
Okay.
PaCO, if your PaCO2 is low, it's going to be alkaline. If it's high, it's going to be acid.
Well, they're both
Yes.
low. They're both low, so how do
Then
you know which
that-
is which?
I just said, PaCO2, if it's low, is always going to be alkaline. If it's high, it's always going to be acidic. The HCO3, if it's low, is always going to be acidic,
Acidic.
and if it's high, it's always
Oh
going to
my
be
God.
alkaline.
Now I'm confused.
They're
Don't
backwards from each
panic.
other.
You know what your problem is? Not sorry. That sorry to use that word, but
Oh my
I think
gosh.
you're, and I know you're confused.
She's overthinking
because
it.
I don't have the. Let's use a different one that has actual clinical problems. Let's use a different one. This one right here, acid-base
So,
problem.
Oy.
low.
You know what? I want you to do these acid-base problems when you go home. It's good practice for you. The problems and the so there's two of them. ABG practice questions and the other one acid. Let's practice this one. Oh no, no. You're gonna do this at home. That's this one. Practice questions.
That's where you were, wasn't it?
Okay, let's use this now. Now, this is how your test is gonna be, not just the numbers. Because just numbers without the clinical scenario is gonna be hard to interpret. Look at, it says 3 cup. So I'm already thinking,
Respiratory.
yes, very
Okay.
good. Dyspnea, I know, respiratory, okay? And then here's the
chest pain, so left low,
pH,
pneumonia.
where's the
Okay.
pH? 7.25, okay? And then your carbon dioxide is, PCO2 is 58 and 60 is your, so it's always pH, PCO2 bicarb. pH, PCO2 bicarb, okay? So the PCO2 is up, right? So 7.27, is this normal or no?
No,
So what's this one?
it's acid.
Yes, respiratory acidosis and the bicarb is high, so
Metabolic alkalosis.
compensating.
Compensating, yeah.
Yes, very good.
Acidosis.
The alkalosis is trying to correct the acidosis. Very good.
Okay, the
So you would write that.
metabolic,
Respiratory acidosis
Acidosis.
compensating.
respiratory
That's working on
acidosis.
I know it's compensating because this went up, meaning the kidney is still working, it's trying to work.
Because
She still has functioning kidneys,
3 is increased.
trying to correct it.
Okay,
You got that?
I think so. 5 liters.
So if
5
the- if the-
cannula.
if the
Don't worry
pH
about this one, okay?
So if the
Okay.
pH was too high instead of too low,
It'd be
you'd say
alkalosis.
Metabolic alkalosis.
alkalosis, respiratory,
Compensating.
compensating.
Yes.
Respiratory compensating.
But because here in this clinical situation,
It's
I already
respiratory.
know it's respiratory, right? Let's look at the second problem right here.
Respiratory,
What do you think? COPD again. So I'm thinking respiratory. She says she has chest pain, tingling in her hands, or going to pass out. Now let's look at the ABG. 7.54.
She
High,
hyperventilated.
And then the
The
the-
obsessive compulsive disorder.
carbon dioxide is low. So what's this one?
She says she has chest pain, shortness of breath.
With
tingling in
severe
her-
anxiety attack.
She hyperventilated.
Hyperventilation. So it is,
Respiratory
yes,
alkalosis, compensating.
No.
Uncompensated.
Uncompensated.
Mm,
7.5.
Because it's high,
So her
The
pH
pH is high and then the,
If
Yeah,
the
but they're-
bicarb
is
is high.
high.
in
but the
respiratory-
bicarb is high and the other one is low, so wouldn't that be in the process of compensating?
No, they're both alkalosis.
Oh, that's right.
Low
Crap.
and high.
I hate that switch thing.
So respiratory,
HCO3
I know.
what is it, respiratory,
the-
But you'll get used to it.
Can we make a cheat sheet?
what is it, respiratory alkalosis or,
It's respiratory because of the anxiety attack. You know, you hyperventilate. You go into
Okay.
respiratory alkalosis. This patient is uncompensating. Uncompensated.
Uncompensated?
Yeah, because the metabolic is also high.
Sated, because the metabolic is high, but the
You getting used to it? Yeah.
No,
If they go the same direction,
uncompensated.
they're compensating. If they go opposite directions, they're uncompensated, right? The PCO2 and the HCO3?
is low. So it's compensating if they're both high?
They're both going up.
No, because
No,
the CO, the CO2 is
32-year-old
down.
male.
Respiratory alkalosis uncompensated. This is uncompensated.
No, we're talking
No,
about.
I'm talking about
this.
two.
Number
Go back to two.
Oh, this one here?
Yes.
Yeah.
So what?
If one is going up and one is going down, that means they're uncompensated. If they're both going the same
No,
direction,
This is going down
Yeah.
and this is going up.
that's
So
what I
it's
just said.
So
uncompensated.
that's compensating.
I
I
said
thought
that,
it
you
said
told me
it's
no.
uncompensated.
That's compensating.
You told me no.
When? So
Just a second ago.
Just a second
you
ago.
both are confusing me.
Oh my God.
Don't do a cheat sheet where this is high, this is low.
I'm not. I asked you and you said
Okay,
no, that
so
was
let's-
uncompensated. And I was,
But the pH wasn't involved in that conversation?
Again,
no, the pH isn't right.
Yeah, it's
That would
pH
be-
is too high.
Respiratory alkalosis
Yes.
uncompensating. And you said no.
No, it's respiratory alkalosis. It's not compensating. Why?
because the pH is still high.
No, it's not compensate. It's uncompensated, and it's not compensating
Did she not
because
just say it was
this
compensating?
metabolic
Yes.
should go down,
I quit.
right? Acidosis, respiratory acidosis should be corrected by metabolic alkalosis. Respiratory alkalosis should be corrected by metabolic acidosis. And look at this one. This is respiratory
I see.
alkalosis and it's metabolic alkalosis. How can that be compensating?
Alkalosis. I have no idea.
I quit.
Oh my God, okay, because the CO2
You
is
always
low.
look at the clinical scenario. It says there, anxiety attacks or hyperventilation.
Oh,
And
I
the
knew what her
pH
diagnosis
went-
was.
Okay, just let's look at this one. The pH went up, so it's alkalosis. She was blowing too much carbon dioxide, so respiratory alkalosis because of the anxiety. See, look at her respiratory rate is high.
Mm-hmm.
So she's blowing off too much carbon dioxide. So she went into respiratory alkalosis.
Understand that.
The question is this correcting? It's not, because that's also a picture of alkalosis. If your bicarb goes up, that's alkalosis. The bicarb should go down. If the bicarb went down, then that means it's compensating. So this is uncompensated. Okay? Next, this one.
So that's
Okay, 55 milliliters.
Vomiting. So what are you going to
3 days.
guess for vomiting?
Metabolic.
Metabolic. So 7.58, what's that?
0.58 is too high. It's too basic, whatever.
So this is too high, and then the carbon dioxide is high, the bicarb is high. So persistent vomiting.
I
so
can't see
this
the
is-
numbers. What are the numbers?
55
Just
and
put them
80.
over. The arrow. 55, okay. High and 80 is too high. Okay. Okay, so we know it's metabolic.
metabolic alkalosis.
Alkalosis.
Uncompensating.
Compensating.
Metabolic.
Should be compensating.
Alkalosis.
Because the patient is vomiting, so you don't say respiratory because
Yes,
vomiting
baby,
is
do
not
you
a
have a-
respiratory problem, right? So it's metabolic what?
Alkalosis compensating.
Compensating. Very good. Why not compensated?
Because the pH is still
It's
out.
still normal. It's still abnormal. Very good. Next.
I got it.
How about this one? Cirrhosis of the liver. What are you going to guess?
It's metabolic.
Metabolic. Look at the pH.
Normal. For
Alkalosis.
Alkalosis.
Metabolic.
20, 80.
Uncompensated.
Cirrhosis, liver, secondary alcoholism.
Metabolic alkalosis, but the PCO2, look at what's going on with the PCO2, is going down. So,
Losis.
that's correct.
Uncompensated.
You can write now here, they're both This is telling me alkalosis. This is also telling me alkalosis, right?
Mhm.
Yeah.
This is also telling me alkalosis,
Alkalosis.
right?
Nothing's being fixed.
So what are you going to write? Combined respiratory and metabolic alkalosis. That's correct. Nothing is being fixed with this patient. This needs
So it's alkalosis
A
if
lot of
the
prayer and help.
bicarbonate is high, and alkalosis if the
So it would be a
CO3 is low.
combined, yes.
it would be so if they match in all three of them, then it's always combined.
What are you going to write? You can write combined metabolic and respiratory alkalosis.
Okay. Because you wouldn't think
Combined
cirrhosis would affect the lungs, but I guess.
metabolic and respiratory alkalosis uncompensated.
I bet you this one, you know that when you have cirrhosis, you know that there's blockage. You know cirrhosis patients have,
Did-
It's a fatty liver, so
no, they
it's
have
blocking something.
varicosities. Have you seen some patients with
Oh,
cirrhosis?
that's
So it's
right.
blocking the return of blood, and so there will be pulmonary edema and all that stuff. So that's why the patient went into
That and with all that alkaline they're trying to blow off or
Okay.
retain it
What's
anyway.
this one?
7.28 is
Metabolic again,
low.
right?
Should be.
18-year-old with ulcerative
27 is
colitis,
acid.
confused diarrhea, metabolic.
So metabolic acidosis.
Combined.
So this is telling me
No, it's-
acidosis. This is telling me alkalosis, right? And this is telling me alkalosis, right? If the PCO2 is low, that's alkalosis. If the PCO2 is high, it's
al-
acidosis. And here, if it's low, it's acidosis. High is alkalosis, right?
Yep.
So this one is acidosis. They're both alkalosis. So what are you going to write here?
Metabolic.
Also, metabolic,
acidosis.
Profuse diarrhea for 3 days. So what are you going to write? Metabolic acidosis because the pH is low.
Mhm.
Metabolic
Uncompensated.
acidosis what?
Uncompensated.
Uncompensated. You can also write, some people maybe they will want to write combined metabolic or respiratory, combined metabolic and respiratory acidosis uncompensated.
Is that okay?
Yeah, that's
Okay.
okay. Or because of the picture, you just write metabolic acidosis uncompensated.
Uncompensated.
How about this one? Pulmonary fibrosis.
That's a
It's gonna
respiratory.
be respiratory.
Respiratory. It's very easy,
Respiratory.
right?
That's compensated.
Normal. The pH
Compensated.
is normal. so-
Respiratory, you know it's in
Compensated.
acidosis, right? But it's already corrected, so compensated respiratory acidosis.
Acidosis.
Compensated respiratory.
How about this one?
That's compensated too.
So pregnant woman, so normal, this one is low and that one is high.
So it's metabolic alkalosis compensated.
Metabolic alkalosis compensated, very good.
Or combined.
Hold on.
Or you can write. So
0.43?
what can be
How
the
is
right
it,
answer? You can write metabolic
how is it?
alkalosis
Is that because it's
compensated.
almost, okay, how is it alkalosis if the normal level is 7.45 and she has a 7.43, she's within normal levels?
But
It's
this is
compensated.
high.
And the
Working.
PCO2 is low.
And the PCO2. So you can write respiratory alkalosis compensated too. They're correct answers. This is normal, but this is not normal. You see that? This is normal, but
Uh-huh.
they're not normal. So she must have been in alkalosis or acidosis, but you're gonna write it's corrected, it's compensated. How about this? Congestive heart failure. So in furosemide. So I'm thinking this is a metabolic patient. This is high, that's
Alkalosis.
alkalosis. This is
High.
high, that's acidosis. This is high, that's alkalosis.
It's uncompensated.
Because, yes, because I know that this is
Metabolic alkalosis.
metabolic, right? So I'm going to write metabolic alkalosis.
Uncompensated.
Uncompensated or compensating.
Compensating.
You can write uncompensated. That's the correct answer too because it's not compensated yet. You can also write compensating because I know that this is already trying to work. So both of them are
They
really
both go
correct
up.
answers, either compensating or uncompensated. Okay? What about this one? Asthma. So I know it will be
Respiratory.
respiratory. Look at, obviously, respiratory acidosis, right? Respiratory acidosis, the kidneys are trying to compensate. Compensating. Okay? So always look at this, the clinical presentation. There's only 15. So here, what about this one? Diabetes. So I know
Metabolic.
presents with shortness of breath. Oh, wow. Now,
Acidosis.
chest x-ray shows infiltrates. The sugar is 100.
600.
7.19 is
Acidosis.
Acidosis.
This is normal. This is high.
High. So compensating?
No, uncompensated.
Uncompensated what?
Respiratory and metabolic acidosis.
Where are we? This one? This
No,
one?
that
one.
This one. So this is low, so acidosis.
Uh-huh.
This is normal. And this is high, so alkalosis. So what's our diagnosis?
It could be either respiratory or metabolic, depending, because he's got both.
Okay.
He's
We're
got
gonna look
shortness
at,
of breath
let's
and
look at now
diabetes.
shortness of breath.
Cough,
Metabolic.
Cough, reductive green screen, blurred vision.
So-
But his CO2 is normal.
This is a case that's going to confuse you. This is meant to confuse you. But the answer is respiratory.
Respiratory.
Even though his
Because even
CO2 is
though
normal.
The patient is a diabetic. Very good question. Even if the patient is a diabetic, she comes to the office with shortness of breath.
And a blood sugar of
That's a
600.
respiratory.
That's very good. The blood sugar is also 600. So you're going to write, but then look at
Respiratory acidosis.
productive green sputum. I bet you the sugar went up because she's stressed out. She has a
She's got
respiratory
pneumonia,
problem.
yeah.
Yeah. So I'm going to write. What are you going to write? What are the possible correct answers?
Respiratory
Acidosis?
acidosis.
Yes. Respiratory acidosis.
Isn't the kidneys
Uncompensated.
Compensating?
You can write compensating or uncompensated.
Okay, so
They're
it
both
just,
correct.
okay.
Is
That's
it's
what I
not
understand.
compensating yet because the PCO2 is normal.
But the bicarb
But
is
the
trying to
bicarb is
correct.
high, it's 60, so it's
The
trying to correct
bicarb
the
is trying to
situation.
correct.
So
Oh,
it's
okay.
compensating, it's trying to fix it.
You're getting
It may be
it.
uncompensated, but it's trying to
You're
fix it.
getting it. It's
Could you write metabolic acidosis though?
metabolic acidosis.
I bet it's a combination of both. Uncompensated, yeah.
Uncompensated, yes. You can write metabolic acidosis. It's uncompensated.
She's in deep crap.
But really, it's respiratory.
Sorry, yeah.
If they don't get it fixed, it's going to be both, and she's going to be in trouble.
Remember that this is not just only with sick patients. We can also go into this. Sometimes you notice yourself breathing fast.
Respiratory,
What's
alkalosis,
You see, you understand it already.
and I don't know about the compensating, okay,
alkalosis.
compensating.
So alkalosis, I'm gonna write alkalosis. This is alkalosis. This is alkalosis.
It's combined.
My goodness, they're not. None is compensating. They're both combined. So you can write combined respiratory. Combined is respiratory, metabolic and respiratory.
Where's the metabolic part?
combined.
This is metabolic. Look at the
Well,
heart.
it's COPD and congestive heart failure.
So that's
The
a
heart
metabolic
is
problem.
metabolic.
It's not
problem.
if a lung problem is always
Respiratory
respiratory.
Okay.
So you can write combined respiratory metabolic, or you can write
Alkalosis.
metabolic alkalosis
Alkalosis.
uncompensated.
Uncompensated.
Yeah, you can write that one.
Okay. Can I
Or
say
combined.
Or
compensating?
compensating.
It's trying to
Oh,
fix
yes.
it?
Yeah, that
yes,
one's compensating.
yes,
Okay,
you can
because
write.
they're both high.
Yes.
Okay. All right, I think I get it. Okay.
Last 4. How about this one? 6-month pregnant, vomiting. So
It's metabolic.
obviously
Metabolic.
Oh, 7.6.
7.6 is alkalosis.
Alkalosis.
Compensating.
Look at that. Metabolic alkalosis.
Compensating.
Compensating because
Compensating.
the carbon dioxide is.
Low.
Is going down.
It's going down and the stuff is going up. Okay.
How about this one?
Acidosis.
Acidosis.
Well, what's the
Metabolic.
Heart,
Congestive heart failure.
renal failure,
Metabolic.
so metabolic,
Acidosis.
metabolic acidosis.
Compensating.
Compensating.
How about this one? Very easy now, isn't it? Oh wait, tobacco and then
Severe
diabetes.
abdominal
Oh my
pain.
goodness.
Abdominal pain, it's gonna be
Acidosis.
metabolic.
Metabolic what?
Acidosis.
Acidosis.
Compensating or uncompensated? Compensating?
Compensating.
That looks like it's compensating.
One's going down, one's going up.
Yeah, okay.
No.
Technically,
No,
Because
there's
this
no
is
respiratory
That's uncompensated.
This is acidosis. This is alkalosis. This is alkalosis.
So it's
So-
not compensating, it's uncompensated.
Yeah. So no, it's what are you gonna write?
Metabolic
Metabolic
acidosis.
acidosis, uncompensated.
Yeah.
None. There's
Uncompensated?
No one compensated. Not compensated yet, right? And then
Oh,
finally
because they're
this
both
one.
high.
Yeah.
Okay,
How about
got
this
it.
one?
Or one's low, one's high.
That's
Where's-
normal.
Normal,
That's low,
low,
and that's high.
high. Bipolar. After swallowing, oh, this is very common. Bottle of
It's
acid,
metabolic,
metabolic.
alkalosis, compensated.
Yes. Okay. So you want to practice
Oh, yeah.
with the worksheet.
No, we don't.
Yes, we do.